We want to get you on the path to recovery as soon as possible. Once you're back from surgery, we start with a few clinical checks and you'll be encouraged to start your exercises. We'll explain all these tests to you, but feel free to ask questions at any point.
We will check your vital signs regularly. These will include blood pressure, pulse, respiratory rate, oxygen levels, and temperature. The circulation and movement of your legs will be checked regularly. We will give you calf pumps to wear to help promote good circulation. We will also give you blood thinning medication to reduce the risk of blood clots forming. We will also get you up and mobilising as soon as possible. You may also be taken for an X-ray following your surgery. This is routine and just checks that the joint is in the right place. If you have had hip surgery, your surgeon may have given you certain precautions to follow. They may have given you a wedge-shaped cushion to use to help prevent you crossing your legs. You will need to follow these precautions immediately after your surgery. But don't worry, we are here to guide you and advise you along the way.
You'll have a dressing over the surgical site and you might need to wear anti-embolism stockings. Because of this, and because you'll be walking pretty soon after your operation, you'll need to bring comfy, loose-fitting trousers or shorts to wear in hospital.
During your stay with us, it's very important that you follow the advice of your care team very carefully on everything from medications to exercises. We want you to be an active participant in your rehabilitation process. This will give you the best chance of a smooth recovery. We know this is a painful operation, but we will ensure you have adequate amounts of pain relieving medication to help you participate in your rehabilitation process.
While this was true in years gone by, the vast majority of our patients actually get out of bed on the day of surgery. This has been shown to reduce the potential risks associated with major surgery. Being immobile following surgery increases the risks of blood clots and infections. Our team will be on hand to help and guide you on your first steps with a new joint.
Planning for your discharge starts before you even come into hospital, which is why you'll be seen at pre-admission clinic before your operation. Your consultant will give you an estimate of how long you'll be in hospital, but really it's about how soon you meet your discharge goals. If you meet these, then you'll be ready to go home. To help you get better as soon as possible, we'll encourage you to do your exercises and walk with your walking aid as soon as you can after your operation, and we'll progress this as soon as you're able. We'll know that you're ready to go home when your pain is under control, your surgical incision is stable, you're safe and independent walking with your walking aid, which will usually be sticks or crutches, you're safe going up and down the stairs, you're independent with washing and dressing and getting on and off the bed, and that you're happy with all the necessary precautions to follow when you go home. However, this is just the start of your recovery, and you might need some help from a friend or family member when you go home. It may take a couple of weeks to regain your mobility, and it requires work on your part. It may take up to 6 months before you feel the full benefit from your operation.
While this may have been the case in the past, with changes in technology and advances in modern medicine, the length of stay in hospital has fallen dramatically over the past 10 years. As such, our average length of stay after a joint replacement is only 2 days, and some patients are now starting to go home on the same day they have the operation. Research shows that the less time spent in hospital can have long-term benefits for the outcome of your surgery. If you do have any questions about the procedure, however big or small, be sure to ask your surgeon or another member of the BMI healthcare team. We're here to make you feel as comfortable and informed as possible.